You can access VisualDx anytime, anywhere by creating your own personal mobile account. Here's how. From a clinical computer, go to visualdx.com/visualdx. Click Get the Mobile app. Then create your own personal account by filling out the simple form. Download the VisualDx app to your Apple or Android smartphone or tablet. Then launch the app and sign in with the credentials you created, and you're ready to go. Welcome to VisualDx Mobile. Decision support accessible anytime, anywhere. You can access medicine's fastest second opinion at the point of care. From the homepage, you can search for a diagnosis or build a differential based on a chief complaint, medication, or travel finding in seconds. A family recently returned from a trip to Puerto Rico. While there, the father developed a rash and mild fever. Now at home, he's complaining of persistent joint pain. He worries he may have the Zika virus because he's heard a lot about it in the news. Start building a differential by typing in rash. Now we'll change the age and sex of the patient to 45-year-old male. Under skin lesion type, we will select erythema. You can refine your lesion type or select erythema to continue on. Scroll through the guided workup and enter more findings. Under distribution of skin findings, we'll choose widespread. Under symptoms and signs, we'll mark fever and arthralgia. Then we'll enter the onset of findings as developed acutely over days to weeks. You can also add findings in the additional findings bar at the top. Let's type in Puerto Rico. The differential strength bar at the bottom of the screen shows how weak or strong your findings are when it comes to refining your differential. You can view your results at any time. We now have 4 diagnoses that match all 7 findings. Diagnoses in red indicate emergencies or life-threatening diagnoses. You can view the differential as a list, by photos, or by symptocons. Symptocons are used to illustrate symptoms of disease. In the symptocon view, you can easily see the indicators that differentiate these diagnoses. Click any diagnosis to quickly review clinical content and images. Because of VisualDx, the father in our case study was accurately diagnosed and treated for chikungunya. VisualDx patented Smart Search allows you to quickly look up a disease or build a differential. Search by diagnosis, medication, chief complaint, or travel finding. Once you start typing, choose the most relevant term from the drop-down menu. A 62-year-old African-American male comes to see you with a new rash that's very painful. You know it's shingles. A quick search of herpes zoster gets you right to the diagnosis page. Click Images and use the filter to see herpes zoster variations by skin color, image type, and body location. Now, scrolling down the diagnosis page, you can also review synopsis, ICD codes, what to look for, diagnostic pearls, differential diagnosis and pitfalls, best tests, management pearls, therapy, associated medications, and references. Let's review therapy to understand the dosing and see that we should be prescribing valacyclovir every 8 hours for 7 days. VisualDx has tens of thousands of medical images vetted by our medical image team that cover various disease stages, body locations, skin color, and more. You can filter your images to quickly narrow your search to find the image that best matches your patient's presentation. Let's look at psoriasis. Click View All Images and note how we show you how many images we have for each diagnosis. Now click on Filter Images. You can choose skin type, image type, and body location. Experiment with a combination of filters to further refine your results. We've also given you the option to filter out genital and severe images if you are scrolling through those images with your patient. Test your knowledge with a VisualDx quiz. From the home page, select the menu on top to choose Quiz. Select the specialty you would like to focus on, or select all specialties to get a little bit of everything. Finally, you can choose the degree of commonality. Now you're ready to begin. Each quiz includes 20 questions that are randomly pulled from our database of diagnoses. When you complete all 20 questions, your quiz summary will appear. You can play again or review your quiz. Points are given for several accomplishments, such as completing your first quiz, the number of correct answers, or how quickly you completed the quiz. We'll select Review Quiz. All of your quizzes are stored in your history, and you can review them at any time. Covaris and VisualDx have collaborated to offer the VisualDx Risk Management Continuing Medical Education Program. This program is designed to focus awareness on diagnostic error and delay to help reduce misdiagnosis, failure to diagnose, and delay in diagnosis. In the app, click the menu in the upper left and choose CME. Your potential CME credits will be displayed. Choose Complete Potential Credits. Select the desired month and the VisualDx session for which you want to claim credits. Complete potential credits by specifying how you used VisualDx to address a clinical problem and how the activity resulted in change to your knowledge or care. Please note, per AMA CME guidelines, if you select No Impact on Knowledge or Care, the potential credit will be marked for deletion as it cannot be claimed for credit. Complete only those credits acquired in a clinical setting at the point of care. Once you have completed your credits, return to the CME page. To claim your credits, click Claim Completed Credits, then the check mark at the bottom. You can now view your certificate and print as needed. The VisualDx mobile app helps to quickly disseminate information to patients using the built-in email and print features. You can print or email patient handouts during an appointment for hundreds of common and important diagnoses. Select Information for Patients from the upper right menu. Change the language of the handout by tapping the down arrow, then choose the appropriate language. Adjust the handout's image by using the arrows. You can also remove the image completely by unchecking the image checkbox. Select Print or Email at the bottom of the screen. Now your patient has easy-to-understand text explaining their diagnosis that they can refer to back at home. The VisualDx homepage on Android is simply designed to help you start building a differential. Begin by typing a chief complaint, medication, diagnosis, or travel finding. You can also click on the Quick Start Differential Builder to start building a differential from the most common chief complaints. Click the top left menu to access other features, including our quiz and CME. You can also purchase or renew your license, access information on public health and education, learn more about VisualDx, contact support, and adjust your settings. In Settings, you can change your default patient age and sex, as well as the region in which you are working. Changing the region will show diagnoses endemic to that region when appropriate.